What's next for Obamacare? Both presidential candidates have criticized the Affordable Care Act. Hillary Clinton wants reform. Donald Trump wants repeal. Here to talk about the future of Obamacare, GOP consultant Matt Mackowiak and Philip Martin with Progress Texas. Matt Mackowiak, starting with you. Is the Affordable Care Act doomed no matter who moves into the White House?
Yeah, I think clearly the answer is yes. If you just look at the statistics here, it's true that if you didn't have health insurance before Obamacare passed, and you do now, that you've benefited, but almost every other person, which is 70 or 75% of the public, has been disadvantaged, not able to keep their doctor, premium increases, lack of coverage. You have a large number of states now that only have one option. Obamacare is really failing. I think that's clear. It's not even really a partisan point anymore. I think what Democrats want to do is they want to expand it. They want to, basically make it Medicare for all, which is not sustainable already. Medicare is a huge entitlement that's breaking the bank and not sustainable. So I think Republicans are going to push to repeal it. They have a number of ideas of ways to replace it. There are bills in the House and the Senate that they could replace it with. It's going to be a big fight after the first of the year, no question, no matter who wins. Okay, Philip Martin, what do Democrats want to do for Obamacare?
Well, I think we want to keep it. We want to succeed. We want to make it work the way that we've been wanting to make it work from the beginning, which is ensure it's affordable for everyone. And it's important to note that, most people in the marketplace are able to still get subsidies to help cover their costs. I believe it's 80% of Texans that get their health insurance through Obamacare are going to only have to pay about $75 a month for the premiums. That's good. And that's something that didn't exist for years. You can look back to all the years Governor Perry was in charge in Texas. We didn't see any improvement in our health care numbers. We've seen over 1 million more Texans get health insurance in the last couple of years. I think that's a success. I think anybody would point to more people getting insurance as good. And the result of kicking people off of those insurance plans, which is what many conservatives have called for, is that we're going to see property tax bills go up because hospitals costs, charity cares are going to go up. So I think there's ways we can reform Obamacare and the Affordable Care Act. I think Hillary Clinton's laid those out. Okay. I think that we need a chance for her to do it.
Yeah, Matt Mackowiak, to most people it sounds pretty good that more people are being covered by health insurance. What do you say to that?
Yeah, I've got to correct one thing Philip said. He said, Governor Perry did nothing to expand health care. When they passed tort reform in Texas, it did wonders for expanding health care access and options, including in South Texas, where you almost couldn't find an OBGYN before tort reform passed in Texas. So I have to correct that. Now, look, going forward, I'd be curious to know what Philip thinks is not working in Obamacare. My guess is he won't admit anything specific is not working. What's clear is that these exchanges are failing in state after state after state. The Oregon exchange was a total disaster. You're seeing, as I said before, rates increase. You're seeing copays increase. You're seeing less choice. And while Obama promised to bend the cost curve down, that's clearly not happened. And so the question now is, are Democrats going to push for a single-payer type system? Because I think there's no momentum for something like that up on Capitol Hill. People want to keep the exceptions, the exclusion exception, the keeping kids on their parents' plan. Those things will continue in a new bill, but I think there is going to have to be a new bill, and they're going to have to repeal it.
Okay, real quickly to the campaign. Philip, Donald Trump been talking about these premium increases in Obamacare quite a bit on the campaign trail. Mm-hmm. Is that an effective way for him to campaign and to bring this issue up all the time?
No, I don't think so. There's a number of swing states, Pennsylvania, Ohio, Nevada, New Hampshire, all that have expanded Medicaid, and Hillary Clinton's still winning in all of those states. So it's clearly not the political liability Republicans wish that it was. Really, like the ultimate fix, there's things that need to be done. We need to control drug costs. We need to ensure that more people actually have insurance to bring costs down. But what you really need is we need an insurance company that's willing to step up for people. Here in Austin, you can buy groceries from Wheatsville, and you can buy them from Whole Foods if you want to pay more. But everyone can also go shop at H-E-B, where it's affordable for everyone. What we need are these insurance companies who were raising premiums well before Obamacare, who were kicking people off insurance well before Obamacare. We need a company that really prioritizes people first over profits. I think that'll see a big change.
Okay, all right, we got to wrap it up. Philip, Matt, thank you both very much.
Thank you.
Thanks.